Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along with us. Also happy to be joined this afternoon by the Acting Mayor of the City of London, Josh Morgan, the Acting Medical Officer of Health at the Middlesex-London Health Unit, and the Executive Vice President and Chief Nursing Executive at London Health Sciences Centre, Carol Young-Ritchie. We're glad to have you along with us as well. And just a reminder for the media in attendance this afternoon that you can submit your questions here on Microsoft Teams. Just click on the question mark inside the text bubble. And when you do, if you could indicate your question as well as your name and your media outlet and who your question is for. And finally, a welcome to those who are joining us this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, and the viewers who are tuning in on the CTV London website. Before we begin this afternoon, I would just like to remind everyone that the purpose of these media briefings is to discuss the latest information about COVID-19 in London and Middlesex County. And I recognize that there are some of you on this afternoon's briefing who may have questions related to the media statement issued by the Middlesex-London Health Unit this morning. However, the Board of Health is not able to speak to personnel-related matters. And for that reason, we will not be taking any questions related to that statement that was made earlier today. We appreciate and are grateful for your understanding. All right, with that, let's begin with our opening remarks, and we'll start this afternoon with Acting Mayor Josh Morgan.
Well, good afternoon, and I'd like to begin my remarks today by thanking and acknowledging every Londoner who has stepped up to offer support to Ukraine and to the Ukrainian people during this time. It also bears repeating that our thoughts remain with those who have friends and family feeling the direct daily impacts of this unprovoked aggression. I've personally spoken to a number of Londoners with family in the conflict zones. We pray for their safety and a quick end to this conflict. For those of us here in London watching or reading about the ongoing devastation, and for those looking to make a difference, there are no shortage of options available. The London Ukrainian Center is an excellent resource. In particular, they're looking for medical supplies, things like first aid kits, bandages, even Tylenol, gravel, baby food, and diapers. You can also make monetary donations, and if you do, and you choose to go through the Red Cross, the Canadian government is matching those donations, which will allow your money to go even a little further. It's in this same spirit of community, this spirit of looking out for each other, and even people we've never met, that has served us so well throughout the 2+ years of dealing with COVID. We continue to see the benefits of those efforts to this day. Fewer serious illnesses, fewer hospitalizations, and every day people are slowly able to feel more confident and comfortable getting back to the types of things they used to do before COVID. Even with the restrictions being loosened and mandates ending, it'll take some time for people, some longer than others, to feel completely comfortable. One person's risk threshold will be lesser or greater than someone else's. That's to be expected. And as this process plays itself out, I know Londoners will continue to be respectful of each other and making space for each other. It's what we've always done. It's what we're especially good at, and it's something I hope will always remain a foundational component of who we are as a community long after we're through COVID. With that, I'll turn it over to Dr. Summers.
Thank you, Acting Mayor. Good afternoon, everyone. I want to acknowledge off the top that tomorrow is International Women's Day, and this year's theme is Break the Bias, allowing us a moment to think about imagining a gender-equal world, a world free of bias, stereotypes, and discrimination, a world that's diverse, equitable, and inclusive, a world where difference is valued and celebrated, recognizing that together we can forge women's equality. We look forward to celebrating tomorrow, and I want to acknowledge that here today. On the COVID front, the Middlesex-London Health Unit is reporting 50 additional COVID cases today and no new COVID-19 related deaths. Our total number of cases since the beginning of the pandemic is 32,181. The number of deaths in the Middlesex-London region since the beginning of the pandemic remains at 351. The province last week entered the roadmap exit step of the Reopening Ontario Act, meaning that capacity limits and proof of vaccination requirements were lifted across the province. However, COVID-19 continues to circulate in our region and across the province, and there are several critical public health protections that remain in place and that we strongly recommend people continue to use. Please ensure that you are masking in all indoor public spaces. and make sure that you limit your time indoors with people who are in your close circle. And of course, if you are unwell, stay home. We still see significant number of cases of COVID-19 in our community, and we know that what is reported is an underrepresentation of the true number of cases out in our community. And as we start to see a rollback on public health protections, reducing our personal risk through simple steps, such as staying at home if you're unwell, maximizing those outdoor social contacts, and of course, wearing that mask will be essential for us to continue to see an ongoing decline in COVID-19 cases. The rate of COVID-19 has certainly declined since its peak in January from the Omicron wave. However, it remains high and is not dropping dramatically at this time. Given the public health protections that have been rolled back, we may and will likely see an increase in cases. Do not be surprised by that. We do, however, want to watch closely what impact that will have on our healthcare system and hospitalizations, as that is an important part of why we had public health protections in place. Spring break is coming up, and I want to remind folks that there are things that you can do to make spring break as safe as possible, particularly if you are traveling. If you are traveling, make sure that everybody in your group has received all eligible vaccines. If they're over the age of 12, make sure they've been boosted. If they're under the age of 12, between 5 and 11, make sure they've received their primary series of 2 doses. In that way, you can ensure that you're reducing your potential risk as you travel. And of course, mask regularly. Vaccination options continue to be widely available across the community. We have delivered over 1.1 million doses of vaccine in our region. Over 70% of those vaccines have been delivered through our mass vaccination clinics operated by the Middlesex-London Health Unit, as well as partnership with the London Health Sciences Centre. In addition to that, nearly 5% of all vaccines have been delivered through mobile pop-up clinics operated by the Middlesex-London Health Unit. And those mobile clinics continue with Community Hub COVID-19 vaccination clinics being run throughout the month of March, including a clinic this afternoon at Saunders Secondary School that gets underway at 3 o'clock, and another at North Bray Public School that starts at 4 p.m. There will also be a clinic at Stony Creek branch of the YMCA this Friday, March 11th from 4 to 7. Please check our appointments and lists of clinics online at our health unit website, or visit covidvaccinelm.ca to make an appointment at any of our mass vaccination sites. As always, thanks so much for joining us, and I'll pass things over to Carol Young-Ritchie from London Health Sciences Centre.
Thank you, Dr. Summers. Good afternoon, everyone, and thank you for having me here to share the COVID-19 situation at London Health Sciences Centre. As of this morning, we are caring for 46 COVID-19 positive inpatients and fewer than 5 within our critical care unit. At our children's hospital, we have 5 or fewer inpatients and no patients in our pediatric critical care. We currently have 2 units which are on outbreak. We continue to work with our partners in infection control to resolve the outbreaks as quickly as possible. While we see the light at the end of the tunnel, these outbreaks serve as an important reminder that our hospital is still dealing with many of the realities of COVID-19. To that end, I'd like to confirm at this time that the Carling Heights Assessment Center will now offer COVID therapeutics, including Paxlovid, on an outpatient basis to those who are at higher risk of severe outcomes of COVID-19. This therapy is recommended for a select patient population, and we have advised those who believe they are eligible to visit our website for additional information. Those who are at higher risk should contact a healthcare professional as soon as possible or self-refer at our Carling Heights Assessment Center for a clinical assessment. Finally, I'd like to take a moment to speak to the number of staff who have tested positive for COVID-19. As many of you are likely aware, we have not updated this number in the past week. With higher prevalence of vaccination and updated guidelines regarding exposure, symptoms of self-isolation, we have updated our tracking method to better align with our current return to work guidelines. This has created a one-time correction in our data analysis process. We were able to update the number approximately an hour ago, and the number of staff who are currently tested positive for COVID-19 is 136. It's important to note that outside of prevalence screening in units experiencing an active COVID-19 outbreak, we've never performed all staff daily testing to maintain a precise count of cases. As in the community, we have used information presented to us to arrive at a daily count. We will continue to do so using the updated guidelines. Thank you.
Thank you, Carol Young-Ritchie, Dr. Alex Summers, and Acting Mayor Josh Morgan. All right, we do have several questions in the queue, and we'll get to those in just a moment, but just a reminder for the members of the media in attendance on this afternoon's call, if you do have a question, just click on the text bubble inside, or the question mark inside the text bubble here on Microsoft Teams, just at the top of your screen. And when you do, if you could indicate your name as well as your media outlet and who your question is for. All right, let's go to the questions. Our first question this afternoon comes from Jane Sims at the London Free Press. Jane asks, Acting Mayor Morgan or Dr. Summers, do you have any comment regarding the resignation of Dr. Mackey? And as I mentioned off the top, certainly the health unit is not able to comment on personnel matters, and that is from the Board of Health. But Acting Mayor Morgan, I'll pass the question on to you.
Yeah, and just as the Middlesex-London Health Unit isn't going to comment on personnel matters, I don't sit on that board, nor am I privy to any special information about the personnel matters of that board. So it wouldn't be appropriate for me to render comment at this time on this. What I will say is I did read the media statement, and I do see that Dr. Alex Summers will be continuing as the acting medical officer of health, and I did want to express my utmost confidence in him and the team at LMHU to continue to handle the pandemic and give excellent advice to both us and local area businesses on all the measures we should be taking through this particular public health crisis. But that's all I'll comment on today at this time.
Thank you very much, Acting Mayor Morgan. All right, let's go to a follow-up question. And this is from Jane Sims, again, at the London Free Press. Dr. Summers, this one is for you. Dr. Summers, are there any more plans that would help get the stalled out vaccination campaign for kids re-energized?
Thanks for that question, Jane. Certainly, we continue to revisit strategies to increase vaccination of COVID-19 amongst all age groups, and notably our 5 to 11-year-old age cohort, as well as boosters for 12 to 17-year-olds. Our strategy will talk about communication and providing information, ensuring that parents understand the benefits of the vaccine, as well as the essentially non-existent risks associated with that vaccine as well. We know that there's lots of questions about the benefit of the vaccine for 5 to 11-year-olds, and we need to provide space for people to see quality information from experts who know the information about these vaccines. We're also going to be focused on accessibility, and that's where you're going to see our ongoing efforts to be in neighborhoods where we've seen lower vaccine uptake at schools, community centers, YMCAs, in order to provide close proximity of the vaccine so that people don't have to go out of their way in order to receive it. Those are going to be our main focuses. How do we address some of those concerns? What's the information gap we need to fill? And how do we make sure that logistically the vaccine is readily available? We know that this is going to be a slow go from here on in. I think the fatigue of the pandemic has certainly impacted the urgency for which people to get vaccinated, and that's impacting kids as well. So we'll continue to press on with expansion of mobile efforts, expansion of information, and building upon all the initiatives that we've had to date as we try to slowly move the needle. Thanks for that question, Jane.
Thank you for that response, Dr. Summers. Next question is from Sophia Rodriguez at CBC London. Dr. Summers, this one is for you as well. Sophia asks, Dr. Summers, with cases going down, do you think the criteria for PCR tests will open up? If yes, why? And if no, why not?
Thanks for that question, Sophia. A really fair question. I don't necessarily think that PCR testing will broadly open up as cases go down. And the reason for that is that now that Omicron is in our community, it's kind of here to stay, which means that our population level strategy is shifted from the containment approach that we had with Delta and before to a bit more of a mitigation approach where we understand that COVID is going to circulate. And our objective is to identify it in certain environments where outbreak measures are helpful in reducing further transmission. We were doing broad testing of everybody for COVID-19 through PCR testing when we were actively managing cases in all settings. That's no longer the case, and I don't know if that is ever yet again going to be the case for COVID-19. And as a result, the utility of PCR testing in those instances is relatively small. What PCR testing broadly allows us, though, is a better understanding from a surveillance perspective of COVID-19 transmission in our community. I think the question remains is how do we want to do surveillance for COVID-19? And I know that's something that's being actively considered at the provincial level. Even if we're not doing broad PCR testing, there are other surveillance mechanisms, selective testing, hospitalizations, percent positivity, wastewater, other surveillance mechanisms that can help us understand transmission trends in our region. So we'll have to see what the provincial surveillance strategy will be, and that will help to inform how broadly PCR testing is available. I hope that helps. It's a bit of a complicated landscape at this time. I don't see any changes to PCR testing eligibility imminently happening.
Thank you very much, Dr. Summers, for that response. And just a reminder for our members of the media who are on the call this afternoon, we've only got a couple of questions left in the queue. So if you did have a question related to COVID-19 for Dr. Alex Summers, Acting Mayor Josh Morgan, or for Carol Young-Ritchie from LHSC, now would be the time to get those questions in. Actually, speaking of questions for Carol Young-Ritchie, we have one right now from Sophia Rodriguez from CBC London. Carol Young-Ritchie, what do you make of the province's new incentive program for nurses? How has nurse retention been at LHSC during the pandemic? And I understand there was an announcement made earlier today, I believe, about some funding there available for nurse retention.
Thanks, Sophia, for that question. And I will just admit I haven't had a chance to really review that funding announcement in detail right now. But I will say we have shortages right across our health human resources here at the hospital. So while that funding is helpful for nurses, we also have shortages in other areas. So I need to look at that in more detail to really be able to make a better comment on that. I will say retention of nurses have been at the hospital. We've had a lot of nurses, I would say, over the past 2 years who've stayed on a little bit longer to help us with the pandemic. So what we have seen is our retirement rates going up probably over the last 6 months as nurses who have stayed longer have chosen to put off their retirement and are now moving to retirement. So because of that, our nursing demographics shifted a little bit to a younger nursing demographic, and we continue to hire. And certainly we have a new batch of nurses graduating this spring, and we'll be looking to hire as many of those as we can.
Thank you very much for that, Carol. Things move very quickly, and sometimes there just isn't the time immediately to get caught up. So hopefully that gives you some information to get started. Sophia, there is a follow-up question for you, Carol, from Jacqueline LaBelle now from Global News Radio 980 CFPL. Jacqueline asks, Carol Young-Ritchie, LHSC updated the number of active cases among staff today for the first time in a week. Could you explain more about the delay, in particular what was meant by we are currently validating our data?
Yes. So over what we've noticed in our data collection that we just wanted to make sure that it was extremely accurate, especially with the new guidelines coming out. So again, we don't test all our staff. We have screening criteria, and that screening criteria then leads to a test if one of our staff members need it. As the screening criteria changed, we also changed our data collection for that. So we've just made sure our processes are correct, and we're reporting that now daily.
Great. Thank you very much for that response, Carol. And that does bring us to the end of our questions for this afternoon's virtual media briefing. To Carol Young-Ritchie from London Health Sciences Centre, Acting Mayor Josh Morgan, and Acting Medical Officer of Health, Dr. Alex Summers, thank you, as always, for your insights and your information as we continue to navigate the challenges of COVID-19 in London and Middlesex County. That does bring us to the end of this afternoon's virtual media briefing. We will be back on Thursday afternoon. That will be the 10th of March at 2 p.m. We hope you'll be able to join us then. So between now and Thursday afternoon, thank you for your time. Thank you for joining us today, and so long for now.